Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another episode of Your Questions Answered. In this week's episode, I want to explain what is an induced coma and why is my critically ill loved one in an induced coma. Many visitors to our IntensiveCareHotline.com website want to know about what an induced coma exactly is and why their critically ill loved one is in an induced coma. An induced coma is generally required if your critically ill loved one requires mechanical ventilation with a breathing tube, because otherwise your loved one couldn't tolerate the breathing tube in their throat, and an effective ventilation therapy would be nearly impossible to achieve. Mechanical ventilation is normally initiated if your loved one has had a major surgery, developed respiratory failure, or developed major heart problems such as a heart attack. The list could go on, but basically any condition where major organs such as the heart, the lungs, or the brain stop working properly require mechanical ventilation with an induced coma. Your loved one also requires an induced coma if he or she requires a comatose state to be able to minimize vital body functions such as brain function and brain activity, especially if your loved one sustained a severe brain or head injury with increased brain pressures that need to be minimized in order to minimize potential and irreversible damage to the brain. It can be quite overwhelming, frightening and scary for family members of critically ill patients in intensive care to see their loved one in an induced coma. They therefore normally have numerous questions running through their mind. Some of the most common ones I'd like to answer here. Number 1. Can my loved one hear me whilst he or she is in an induced coma? Generally, most critically ill patients in intensive care don't remember much, if anything at all, about their stay in intensive care. Having said that, many critically ill patients report that after their stay in intensive care, they don't remember any details, but they do remember that family members were talking to them, holding their hands and so forth. I therefore strongly encourage you to talk to your critically ill loved one and also to touch them, hold their hand, even if they appear to be totally unconscious. Number 2. Is my loved one in pain whilst in an induced coma? Generally speaking, an induced coma serves the purpose of having a critically ill patient pain-free, and especially if your critically ill loved one has had major surgery, pancreatitis, sustained a multi-trauma, or is undergoing other invasive treatments such as ECMO or intra-aortic balloon pump. An induced coma establishes comfort, and generally pain is managed well and efficiently during the induced coma. Some of the drugs given in an induced coma are morphine or fentanyl, and they are both very strong and potent painkillers or opiates that usually take care of your loved one's pain. Number 3. When will my loved one wake up from the induced coma? Again, generally speaking, the induced coma is a temporary state from which your critically ill loved one should get out of as soon as his or her condition allows, after vital body functions have been regained, such as a controlled brain pressure in severe head or brain injuries, or after a stroke, or after multi-trauma, or after major surgery. Your critically ill loved one is being brought out of the induced coma by reducing the sedation or the drugs that your loved one is getting. This is often a gradual process, and your critically ill loved one is most likely not waking up with a bang. It might take a few hours and sometimes even a few days until your loved one is waking up. Number 4. What if my critically ill loved one isn't waking up from the induced coma? After sedation and the drugs that your critically ill loved one is getting have been reduced and switched off, and your loved one still isn't waking up, there could be a number of reasons for it. For example, if your loved one has been in an induced coma for many days or many weeks, it might take a while until all of the drugs have been washed out of your loved one's body system, and therefore waking up might be delayed. Furthermore, if your loved one sustained a severe head or brain injury or a stroke, or had a severe cardiac arrest with lack of oxygen to the brain, there may also be a delay in coming out of the induced coma and waking up. If this is the case, you mustn't give up, and you need to give it time, irrespective of what the intensive care team is telling you, because time is often the ultimate healer. If you want to quickly learn how to have more power, control, and how you can influence decision making in intensive care whilst your loved one is critically ill or is dying in intensive care, download your free Instant Impact Report now. In this free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In this free report, you'll also discover how to ask doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability, even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get crucial behind the scenes insight so that you understand what is really happening in intensive care. How you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact Report, you'll also get 4 other free reports, and the reports you will be receiving are the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you are not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you send me an email to support@intensivecarehotline.com and send me your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.